Hi, and welcome to the first in a five-part webinar series for dental students. We're going to be uncovering the secrets of finding the right associateship for you. So today we're going to start with comparing and contrasting different practice types and different practice settings. So comparing urban and suburban with the rural practice locations and private practice versus DSO settings. We're also going to help you know yourself and what's right for you by visiting your core values and your vision. And lastly, we'll end with a dentist discussion and interview with Dr. Mark Sanford, a private practice owner that co-owns 5 dental practices. He's got 2 in suburban settings, 1 in urban, and 2 in rural settings. So he'll be a wealth of knowledge for you in helping you decide where you want to practice. So let's start with that urban suburban area and talk about the pros and cons with working in that population. So most people want to work here. I talk to a lot of young student dentists, and they tell me that they want to be where the action is. And so that's why they choose the highly populated areas. And it's a great place to practice because you do have a lot of patients within that area. You might have a broader range of case types that you'll be able to work with as well. In that market, though, you have a high population of patients, but you also have a high density of dental practices. And that comes with its own host of problems. You may have a lack of patients per dentist. So maybe you'll have 700 patients per doctor in that zip code. And if you went to a rural setting, you may have significantly more. So it's just very competitive. So in that competitive environment, you or the owner has to spend more money on marketing to get those patient numbers up. You want to see around practice having 1,800 to 2,200 patients before adding a second dentist. And in those populations like that, there's a high dental IQ. So they're a little bit more insurance driven. They understand their insurance. They understand the difference between in-network and out-of-network. And they have a lot of options to stay in-network. So there can be a lack of loyalty in that highly competitive market. If you go out of network with an insurance, that patient may decide to move on to the practice down the street who's still in network with their dental insurance. So those are some pros and cons initially of those markets. One big positive that I hear that everyone loves when they first come out of practice as well is advanced technology. And that's much more common in that urban suburban area that you'll find advanced technology like a CBCT, a scanner, mills, 3D printers, lasers, all the little fun toys that you get to play with. And it's going to help you develop some more advanced skills. And I know everyone wants to work with it, right? Because it's new and you don't get exposed to a ton in school. So it's great to be in a practice where you can get some mentorship in those advanced technologies. So in that urban suburban setting, it's going to be a much faster paced lifestyle. There's going to be a lot of traffic. Um, your schedule is going to be more hectic because you have to offset that high PPO presence with those insurance fees. There's going to be more options for social events, and there's going to be an abundance of amenities. And as a young dentist out of school, that's what you want, right? You want to be where the action is, where your friends are, and that's a big bonus for being in an urban suburban area. A con for it, though, is that it's a demanding population because, again, is that high dental IQ. They understand technology more. They understand different procedures. They're going to demand a higher level of care than you may have in a rural patient. So it's something to think about that it may be a little bit more difficult to gain their trust because they know enough to be dangerous, let's say. And so you just need to take that into consideration that it's just a different patient population. So if we go over to the rural practice pros and cons, Um, one of the pros is the patients have had limited access to dental care. In a lot of those places, it's almost like a dental desert. There may be one dentist in a 3 county area. And so although the density is much more spread out, you will you will see that you'll have the opportunity to do a lot more dentistry in those areas because they just don't have a choice. So there's also a lack of specialists. And if you aspire to do more oral surgery, endo, like that, you will have the opportunity here because patients honestly don't want to drive an hour, hour and a half to get specialty treatment, and they may have to wait several months. So they really like to stay in their private practice for those advanced dentistry procedures. So you'll have a much better chance to hone in on those special skills than you might in an urban setting. Um, the patients also tend to have more dental disease. And again, part of that is the lack of care available, and some of it is a lower dental IQ. And so you'll see more people needing treatment. There is a competitive advantage in that compared to the urban suburban settings, you're going to have really loyal patients. There's a lack of competition there. So they don't have a lot of options. And so they'll be very loyal to you. There's marketing cost is very low, almost non-existent in some cases, because again, with the lack of options comes that loyalty and them referring other people to you as well. It's a lot less insurance driven. And part of that is you're in that rural setting, and a lot of the dentists are still out of network or in network with very few insurance. So it's important, when you're first out of school that you have an opportunity to be in a busy practice so that you can get the repetition of your bread and butter dentistry and then start to flex your muscles as you grow and learn the more advanced skills. One of the ones could be that there's limited technology available. There's aging dentists in those areas, and they may not have invested in higher technology. So patients are also unaware of it, and they may be a little scared to when you start to introduce those kind of things. So there's a lot of education that goes on with even adding technology to the rural locations. The patients have a lower dental IQ, so they're not aware maybe that there are options in treatment. A lot of them will just tell me they want to extract a tooth. So there's a lot of education and again, a lot of dentistry to be done. It can be a very rewarding place to work. In a rural setting, if you're choosing to live there, you're going to have a very laid back lifestyle, more quiet. People tell me, oh, great place to raise your family, light traffic, and it's a close-knit community. So you're not just a nameless face, you would be part of that community. And that's a pro and a con. So you have to decide if that feels right for you. And there's that lack of local amenities that you would have in an urban suburban setting. And there's a higher level of community engagement needed. So you build trust here by being part of the community. So whether you live in that community or not, it's sponsoring, sports teams, being involved in the festivals and the parades and, supporting local events. So even though you're not physically living there, you're still going to be much more engaged. That's basically your marketing dollars, right? Is that you're supporting the community and you're building trusted relationships that you really care about the people in that community. So that being said, there's benefits to both. You don't have to live and work in the same place. So some people will choose to live in that urban suburban setting because they have all those amenities, their friends are there, they like that lifestyle. So they can live there, but if the opportunity is better in a rural setting to practice, I see people all the time now living one place and driving up to an hour to go to work because they have a better opportunity for professional growth and income. So vice versa, I guess you could go the other way. I don't see it as often where people are living in a rural setting and commuting to an urban setting, but that does happen as well because you like that lifestyle of a slower personal life, raising your family maybe there, and you're okay, driving the other way to have a practice in an urban suburban setting. So there's no right or wrong. It's just figuring out what are the most important things for you. And that's where we come to the associate dentist practice settings. So you can work in private practice, you can work in a corporate setting, you can work in public health. I'm not going to compare and contrast public health with you today because the majority of students go into private practice or corporate dentistry. So let's start with the pros of private practice. You have the ability to negotiate the terms of your employee agreement. So the doctor may give you an agreement that's got their pretty standard um, things into the employee agreement that they want, but you take that to your dental attorney, have them look through it, and you decide what's important to you as well, and you start that negotiation process. So you're going to have that ability to do that in a private practice setting. You might have more autonomy to practice dentistry, meaning there's not going to be a lot of restrictions on you. There's not going to be someone, saying, hey, you should be doing, these procedures. We want you doing this. You're going to have that autonomy to practice dentistry. There also can be a path to partnership or ownership. And that is something that's, if that's important to you, you want to make sure you get that in writing in your agreement or as a separate agreement where their details are spelled out so that there's not hard feelings later on when 5 years down the road, this is supposed to kick in and you've just had a handshake with old Doc Jones and now he's decided he's not going to retire or sell right now. So you want to negotiate those things up front before you sign your employee agreement, if that is important to you. If that's important to you as well, you get some business ownership mentoring as well. It really helps you understand the business, how that works, so that you're more prepared when you are ready to purchase that first practice. So some cons of private practice would be that there's less benefits available. That means no health insurance, malpractice or disability insurance coverage. And that's a hardship for some people. But others, they can go through the American Dental Association, they find a way to go on their spouse's plan. But you need to consider there will be less benefits involved. And that means maybe no paid time off and a limited paid CE. Now, those are all things that can be negotiated, but a lot of times I see in private practice, they pay a higher percentage of your production or collections, and that kind of offsets the benefits that you get. So those are the basic pros and cons. I mean, there's a lot of reasons people want to practice in those private practice settings, but those are going to be your most prominent pros and cons. So if you go the corporate route, one of the benefits is they offer a lot more benefits. So they'll offer health insurance, paid time off, and a higher level of continuing education. They might have a formal mentoring program or training programs. And you may get a signing bonus or tuition reimbursement in rural or less desirable practice locations. That is very, very, very enticing because you as a student dentist coming out, you have a lot of student debt. And so it's very appealing to say, hey, I could get this large signing bonus. And if that's important to you, then absolutely. But I'm telling you, just have a dental attorney review the rules of that agreement. Because when you get that signing bonus, there are strings attached. There are things that you have to abide by. And it might be time. And there's a various things that they'll attach to that signing bonus. So you want to make sure you understand everything about that before you sign. Dental attorney, he's your best friend. Now, if you go on to the cons for the DSO, we're talking about there might be a limited to no ability to negotiate the terms of your employee agreement. Now, that being said, I have talked to dental attorneys who have told me that They might tell you they will not negotiate. This is it, sign it or don't. But he has had many of them have negotiations, and they will accept some concessions in their agreement. There may be things that are hard and fast they will not negotiate, but there are others that they will. So again, talk to your dental attorney, even if they tell you there's nothing you can do. It's worth the small investment you'll make with that dental attorney to save yourself a lot of heartache down the road. You'll also might have a limited input on your schedule, your workload, instruments, equipment, and treatment options. And that's tough for some people. So just know that going in, that there may be those limitations on your ability to make changes in the practice. And oftentimes there's a lower compensation percentage, and that's offsetting all these other benefits that they are doing. So again, you have to weigh the pros and cons of everything and really look into what you're looking for to get out of that first associateship. What we've just learned about comparing and contrasting, you'll take your core values and your vision and really start to narrow your focus on the type of practice you want to be in. So this is such a valuable step in helping you understand who you are and what's really important to you. And so I encourage you all to go through this worksheet. That'll be a downloadable worksheet here, and you'll pick your core values. Take time with this, really look through these. I always tell people, go through and 8 to 10, just quickly kind of go through it. Don't overthink it. And then go back and really look at those again, and maybe come up with 3 to 5 that really clarify your core values. And then there's some exercises to do once you've identified those 3 to 5 core values. So you'll want to do all of these exercises. Make sure you're not distracted, that you've got the time. It is worth the time you'll spend doing this to really uncover, who you are and what you want to do. Now, 5 years from now, you may redo this and it's totally different. But initially, you want to talk about the first 2 years of practice. This is going to really fit the bill for you. So now, without further ado, I want to introduce you to Dr. Mark Sanford. He lives in the greater Indianapolis area. And like I said earlier, he has 5 practices that he either owns or co-owns. And he has 2 in rural locations, 2 in suburban, and 1 in an urban location. So he's a wealth of knowledge about the different types of practice locations and the pros and cons. So welcome, Dr. Sanford. Dr. Mark Sanford owns and co-owns 5 dental practices. 3 of his practices are in urban suburban settings, and he's got 2 in a rural setting. So I really wanted him to speak to those opportunities as you're searching for your first associateship. So Dr. Sanford, your practices that you have in your urban suburban settings, I know that a lot of students want to work in those settings. They think that's where they want to be, and they don't want to, drive outside of the city center. So what are the pros of those urban and suburban offices for you?
Yeah, I think for the most part, it's just that it's a little bit easier to recruit employees or associate dentists because the majority of them do prefer to practice close to home or in the Indianapolis area. I would say that's honestly probably the main difference. If you want a local lab, it is a little bit easier to kind of get daily pickup and delivery. But if you're doing enough volume, honestly, we don't have any issue in our more rural locations either. But I would say those are really the predominant differences that are pros for the more urban setting.
So the location, maybe an easier drive time or something like that, or the perception of an easier drive time.
Absolutely.
Yeah, exactly. So then what about cons in those areas of urban and suburban? Because, you've got a short drive time, but, there are some cons as well with that.
Yeah, I mean, overhead's definitely higher for several reasons. One, there's more competition in the area, so usually employee costs are a little bit higher in those locations. There definitely is less dentistry to do, I would say. I mean, depending on where you're at in the city and kind of what you can still kind of tailor your patient base a little bit based on your location in the city, but as a general whole, the rural locations, there's just a lot more dentistry to be done. Less percentage hygiene, I would say, and a lot more operative work. We tend to in the rural locations, it's almost a twice as much operative work per hygienist as what you have in the urban locations. So just in general, there's more dentistry to do. There's also less competition from other dental practices, and it's slightly harder, I would say, to recruit talent. But once you have employees that you get in place, I feel like retention's a lot easier because there aren't necessarily five options right around the corner from
Right.
your office. So tend to get a little bit more long-term loyalty from employees.
Okay, great. So that being said, so the cons of working in an urban or suburban setting is there's a lot more competition with dentists. So
Yep.
you're all kind of fighting for that same number of patients. So there might be less opportunity to do
Yep.
treatment. And patients tend to have a higher, I guess, dental IQ in some cases and have gotten more care over the years. So less dentistry to do on the patients, possibly, unless you're doing more specialty type work.
Absolutely. Yeah. And then also like rent or
Mhm.
building and land costs are definitely quite a bit higher in the urban locations versus in the rural locations.
Great. So as a first job for uh, someone coming right out of school, would you tell them to try urban, suburban, or rural? What would your thought be on that?
I mean, it's hard to say like right out if there's one that's better than the other. I mean, I definitely think from an ownership standpoint, kind of the rural locations just tend to be more profitable, but from a working standpoint, I think ultimately just go somewhere where you're going to get plenty of experience, where you're going to have plenty of dentistry to do. That may be in a rural location, it may be in an urban location. I just would say go to a practice where you're going to be able to keep busy and kind of get your speed, your skill set up, and get plenty of experience and practice because dental school, it seems like you're doing a lot of clinical work during those 2 years, but in a busy private practice, you're going to do what you did in 2 years in about 2 weeks. So I
Okay.
would, uh, I would just recommend kind of going somewhere where you're going to be able to be busy and be able to kind of get those skills up.
Yeah, makes sense. So you've talked to the pros a little bit of the rural settings. Anything additional, like in a rural setting, that you would say is for an associate would be a benefit?
I mean, for me, I definitely enjoy doing oral surgery extractions. Certainly in the rural setting, we tend to have a lot more of that, like a higher percentage of that. The other thing is the patient base just tends to be a little more laid back, a little bit more whatever you say, doc. I mean, it's just you can truly practice how you tell them what you think they need, and they tend to listen, and they would prefer you to kind of do the procedure versus traveling to a specialist, which I mean, still some things certainly refer out, but it's awfully nice to be able to kind of push your limit a little bit on what you would normally do just because the patient's truly like, hey, listen, I'd rather you do it. If it gets to a point where you feel uncomfortable, then I'll go see someone, but
Right.
I'd rather you try. And you,
Yeah.
you really don't tend to get that in the more urban setting. It's a little more like, oh, I want to go see a specialist, so you tend to kind of push the boundary a little less, and it really takes that to kind of establish new skills or kind of expand what you're
Okay.
comfortable doing.
Okay. And if someone desires to buy a practice in the future, um, sometimes practicing outside of where you want to ultimately land is going to be better, right? Then there's that, not that non-compete.
Yeah, I certainly prefer that. I mean, I think people are different in that regard, but to me, I don't particularly want to run into my patients at the grocery store, at my son's baseball game. I mean, I love my patients and I love seeing them, but to me, it kind of feels like I'm at work all the time if I'm seeing them everywhere I go in the community. So I kind of enjoy having a little bit of a drive. It gives me time to have my coffee before I get there. It gives me some time to decompress at the end of the day. Some of those cons with the driving, ultimately, I kind of enjoy that. I mean, sure, there's some days where I need to rush home to a baseball game and you run into traffic, but
Yeah.
that's few and far between. So, but ultimately, I don't mind the commute.
Okay, great. So you kind of described the patient difference, which was great because I think that's really important to say that there definitely is a difference in most cases. I mean, obviously there's generalizations here, but it's
Yeah.
for the most part you do have that difference in your patients. So if you were going to give advice to the D4 Mark Sanford back in the day about what you've learned now, what would you tell yourself?
I think the biggest thing, like coming right out of school, is go out and get as much experience you can in those first couple of years, kind of doing as much dentistry as you can, even kind of subbing around if you need to kind of figure out what practice setting you like the best, rather than just kind of immediately jumping into an opportunity where it's like, this is what I'm doing for the rest of my life. I think it's good to kind of see the different sides of whether it be rural, urban. If you can kind of get a little bit of experience in each of those, you not only can you see different ways of running a practice, but there are pretty big differences between location and styles of practice. So getting a lot of experience and then kind of seeing the different options out there to see what makes sense or what you like the best for the long haul.
Okay, yeah, that makes sense. I think a lot of students think I need to know what I want to do right now for forever, and being open to exploring things. I love that idea about subbing, doing some maternity leaves, doing some
Yep.
vacations, and so don't be afraid. It's all going to work out, and
Yep.
just if you don't know exactly what you want to do and you don't want to pin yourself in, then
Yep.
look for some opportunities like that in the beginning as well.
Yeah, absolutely. And I'm not a huge fan of corporate dentistry as a whole, but to be honest, I think it's a great place to learn and to start out, and you can take all of the good pearls from it and kind of leave behind the ones you hate and never want to do again. So,
Like that. So you're in private practice, but you can see the benefit of a DSO for in some cases. And also, I think the DSO might have more opportunity for subbing. So there
yeah,
are those kind
absolutely.
of opportunities to not maybe necessarily tie in forever to a DSO, but to experience it by filling in for them and subbing in different locations. So um,
Definitely.
okay, great. Anything else you'd like to share with the students out there?
I don't think so. I think we hit it all.
Yeah,
Good luck.
yeah, exactly. Good luck, and they'll do great. It all works out. Every
Yeah,
experience they have, positive or negative, in the next 5 years out of school, it makes you who you are, and I think you appreciate them later on. Don't stress. Not everything is going to be perfect, or you're not going to like everything, but
yep,
that's how you learn and grow, and take it and run with it after that.
absolutely. You certainly remember your mistakes more and learn from them more than
Yeah,
than the others. So it's not a terrible thing having some of those.
right. Okay, great. Well, thanks so much for being with us today. I'll let you get back. It looks like a beautiful day there in Indianapolis. The sun is shining and
Oh yeah,
it's no
yeah. It's
almost
not.
November.
That's what I was going to say. It's not typical for this time of year. That's for sure.
Yeah, great. Okay. Well, thanks, Mark. I really appreciate it.